patient safety. You want to be able to make sure you have the correct medical record number so that when the physician does go to your medical record, all of your information is in one spot. And it's not creating a duplicate medical record. And with the right patient, that's the easiest way to do it.
Actually learned that it was even better than the vein mapping, that it is a more accurate process. And what I really liked about it, as in talking with your folks from RightPatient, was that the patient did not have to touch any of the equipment.
If we do admit somebody and they are under a different name, of course there's a patient risk, there's a patient safety risk, there's redundancy of information, there's not being able to bill, we're coming back. So there's a lot of things that prevents for us on the front end versus as you go through the process.
The implementation of the software is about patient safety, about protecting a patient's identity and ensuring that their correct medical record is selected every time they come in, and we do that by capturing a scan of their iris.
Having the equipment that was, the patient did not have to touch, they didn't have to come behind and touch behind other patients. That was a very key part of our decision to go with RightPatient because it is 100% contactless.
Very easy to use and quick. It'll go through the 10 million medical records and it'll locate that one medical record that belongs to the patient within 2 seconds. And it's not creating a duplicate medical record. And with the right patient, that's the easiest way to do it.
We were challenged to look at the revenue cycle and say, how can we participate in this, very worthy goal of having the most patient secure, safe environment that we possibly can create. Our staff accepted it. Our C-suite gave us 100% full support and still do to this day. Other places in our system want this technology. We don't have to go out and sell this technology. We have the physician practices that we own calling and saying, when can we get this product in place?
As an identifier, it sure does help because we will have somebody that has the same first and last name. And we've run across that in our organization quite a bit. With being able to use this particular equipment, your iris is going to tell me which Boudreaux I am. And so that has saved us a lot of risk and some patient safety issues when we identify the patient from the get-go.
We didn't want an infection control perspective. We didn't want people to have to touch the device, all of our patients.
So hygiene was very important.
Hygiene was an important aspect in making the decision.
It is convenient for the patient because when they come in, all they do is sit down, we take the picture. We don't have to ask them to give us a driver's license to prove who they are. We don't have to get all the information all over again.
So our patients have been overwhelmingly acceptant of the technology and enrolling.